Hello and welcome to Community Matters. I'm your host, Gabriel Riviere-Reed. During these trying times, we know that depression and anxiety are on the rise, and joining me now is Angele from the Canadian Mental Health Association. Welcome, Angele.
Hello, Gabriel.
All right, so let's start with, obviously, we'll talk about anxiety, and is it perfectly normal to be feeling anxious during these times?
Yes, absolutely. So we know that anxiety is a normal response to danger or threat, and we are certainly experiencing a high degree of uncertainty right now due to, as we know, COVID-19, coronavirus. So yeah, it's absolutely normal for people to feel anxious. I think it would be abnormal if we didn't, right?
Right. So, talk to me about maybe a little bit what anxiety is and maybe the degrees, because you might have someone feeling really severe anxiety versus someone who's just kind of got that feeling in their stomach, right?
Right. So, we're encouraging people to pay attention to their anxiety levels, and obviously, we want people to accept that this is a normal response um, to what's happening all around us. So, typical symptoms of anxiety is, without it being a disorder, but just feeling anxious, is that increased nervousness, feeling tense, feeling maybe a little bit more restless than usual. Some people may be feeling a little bit panicked, especially as we're seeing so much news and information on social media, not sure really what is factual information, what isn't. So you may feel that increased heart rate, feeling more tired than usual, maybe even trouble concentrating. So again, these are all signs and symptoms of anxiety. But when you're not able to work or you're not able to do your normal activities because your anxiety is interfering with that, that may be next level where you may need some sort of intervention.
All right, and maybe for some of the milder cases, we can talk about some of the tips to deal with anxiety. But one thing I wanted to jump on is you mentioned, of course, social media, and maybe you could allude a little bit to the balance between keeping yourself informed and maybe obsessing and exposing yourself too much to what's going on.
Yeah, and that's kind of some of the recommendations that CMHA, Ontario, and National has been recommending is that, yes, you want to stay informed, but also where are you getting your information? So obviously, YourTV Cogeco Cornwall would be a reputable media source, as is CBC Canada, World Health Organization, but sharing information amongst each other, through, there's a lot of images, there's a lot of different articles that have been written that may not be the best source of information. So really making sure that you're getting your information from reliable sources for COVID-19 to stay up to speed, but also limiting how much information. I know some people have told me that they're removing themselves from their social media for a few days at a time so that they can control the anxiety that they're feeling around this pandemic.
Absolutely. And what are some other simple ways maybe to calm yourself down if you feel like you're in an anxious moment or even a panic attack?
So yes, challenging your thoughts. So I know that we can make a lot out of this and think worst case scenario, but the reality is that most people who experience symptoms of COVID-19 are actually recovering. So I know it can be really challenging to focus on the positive, but if you look at, China, for example, they're seeing a decline in some of their outbreaks and a rise in recovery. So that's a positive thing, and we can expect that as well, although we're kind of in the midst of it right now. We know that things will get better. We just need to be patient, and we need to practice some of the safety recommendations that obviously we've been hearing: washing your hands, isolating yourself, which I think a lot of people are doing. Some people are not, and I would urge them to take this seriously so that we can get past this sooner than later. We know also that researchers are working on creating a vaccine, so that's, it's coming. A lot of people are coming together to support each other. I'd like to do a shout out to some of our local businesses who are dedicating hours for seniors, for example, to reduce the anxiety they may be feeling when being exposed to large groups. Neighbors, helping neighbors. So we are seeing a lot of collectivity, people coming together and supporting each other. And I think those are great things that people can be doing in a time of crisis.
Absolutely. And finally, people, even though we are in the midst of social distancing and staying home as much as possible, there are ways that people can reach out for help and still contact CMHA or other resources?
Yes, so although we are not having face-to-face services, so whether that be education, our drop-in center, or our client services, we're still fully operational, but from a distance. So people can still call CMHA if they're looking for services. Already existing clients are being contacted regularly and supported, so that has not stopped. But there's also much more immediate services that people can access if they are starting to feel anxious, where it's starting to interfere and they want to get a handle on it. We have, as always, Bounce Back. Ontario.ca is a resource that people can start working on their anxiety symptoms or depression symptoms on their own. So it's self-help with coaching support. So if you go to bouncebackontario.ca, you can self-refer from the comfort of your home. There's also bigwhitewall.ca, where you can talk to other people feeling similar symptoms of anxiety or other issues, and this would be an online platform that is immediately available. And I don't want people to forget that kids might be struggling at this time as well. So Kids Help Phone is offering texting support or phone support or live chats for children who may be feeling a little bit more vulnerable at this time.
Excellent. Well, Angele, I want to thank you very much for joining me, and we're all going to get through this together. So I thank you so much for all your tips, and best of luck.
Thank you, and you as well. Stay safe.